Change your brain, change your life. Welcome to the Ketamine Coaching Academy podcast. Join me, Bronwyn Davis, 25 years as a success coach for high performers and the visionary leader behind Conscious Ketamine Coaching Academy, as I guide you through this groundbreaking approach to healing, personal development, and empowerment. Come for the education, stay for the enlightenment, and leave ready to transform. Hello and welcome to the Ketamine Coaching Academy. I'm Bronwyn Davis, your host, and I am here with Dr. Eva Altebelli. Dr. Eva is a board certified psychiatrist, and I'm so fascinated as to how, first off, welcome, and as to how you are working with your clients, your patients, with therapeutic ketamine. Can you share with us a little story about how you got introduced to therapeutic ketamine and why it's so important in your practice now?
I am an addiction psychiatrist, and I was actually trained on the East Coast and I currently work and practice on the West Coast in Los Angeles. I make that distinction because the way we practice addiction psychiatry on the East Coast seems to be more of a harm reduction model across the board, which means it's not abstinent based. It means we work with clients, and this permeates all through the psychiatry practice, not just for addiction. Like we orient that there's not one right way to do things, and meet people where they're at, and what works is something that we come up with together. So I I seem to fall into the category of a harm reductionist on the West Coast, but I have always felt myself to be more of a creative, open to what works with people individually. My background is actually in the arts. I have a fine arts degree and transitioned into medicine. And so I have always been open and interested in existential angst, the human condition, recognizing that there's an innate component of suffering and not necessarily wanting to be in pain. And I found the limitations of my Western psychiatry training to be a bit limited. And integrating ketamine-assisted psychotherapy just made sense as another tool. Like, it is not the practice, it is a tool that we can use to integrate when it's appropriate. But it is also so interesting as I've been working with it since 2019, and I have an amazing team of psychotherapists. We found the nuances of different dosing and different orientations to bring it in to care with clients, and so many different it's sort of transdiagnostic. Like, it's not good for one particular condition. It's alone. It seems to be good for quite a few.
Can you explain more about what a harm reductionist means?
It's interesting for me to even have to define that. And I've noticed that I do have to here because for me, harm reduction just means working with clients individually to curate an individualized plan that works for them. So if you're struggling with some type of self-sabotaging behaviors, because I don't even like to call it like an addiction, it's never really about the behavior, it's about the root cause and what causes it. So if you're engaging in a behavior, it's not about calling the behavior the problem and making it about a behavioral change as much as it is acknowledging that and that being part of it, but saying, let's get to the root cause and be open to recognize that it generally comes from developmental trauma, attachment-based trauma. There are wounds that lead us to self-soothe. And so I think it's more interest in what causes the addiction than treating the behavior.
You talked about how you're seeing nuance. You're seeing nuance with the dosing, you're seeing nuance with the impact it's having on your patients. Can you
Hmm.
share with us some examples? Can you give us some stories about how certain dosing did this, or you are getting different outcomes with this particular protocol?
Yes. So when I first started working with ketamine, I was generally using oral lozenges. Um, and I have evolved to use intramuscular injections. There's two primary dosings that we think about oftentimes in the trainings. They're referred to as psycholytic and psychedelic. Psychedelic is the higher dose where you're quite altered. Your state of consciousness is quite shifted from the norm. Psycholytic dosing is a dose that is high enough to soften your conscious and unconscious defenses, yet low enough to keep you present and conversant in the room. So that is actually a really nice dose, working with clients that are somewhat rigid in terms of what they even have access to in like when you're working with people. I am a psychiatrist and work both as a psychopharmacologist and a psychotherapist. And so oftentimes clients, our goal is to help them make the unconscious conscious and not lead them and not tell them. Like we want them to discover these insights on their own. So when clients have are so defended that they can't access their own limitations, it slows the conversation down enough that it makes that more available to clients, and it can both amplify and expedite the psychotherapeutic process of change.
You talked about the psychedelic dose too.
Yes.
Now, I hear you on the psycholytic dose. That is super beneficial. What about with the psychedelic dose?
The psychedelic dose is actually normally what we do, which is we offer a 3 hour ketamine-assisted psychotherapy appointment, which begins with medical and psychiatric clearance, preparation, um, often really moving at the speed of trust for the nervous system, because some clients think they're ready to jump into a big dose and they really want something because they're desperate for change. But unless you feel really safe and comfortable dropping into the surrender that occurs with the medicine, you can either block it or it can be very uncomfortable. The When we get to our 3 hour medicine administration appointment, we tell clients to wear a short sleeve shirt so that we have access to their upper arm for the two injections. They come in and we sit and we chat for 20, 30 minutes, a little breath work and drop in meditation, blood pressure, the first injection. And I have also evolved my practice over time. It used to be the injection and then a booster. But now I think of it more as the appetizer and then the main course. So we offer a small injection to begin with, 15 or 20 milligrams, which is enough to make you feel relaxed and altered and kind of like slow down the monkey mind, the automatic thoughts, so that you could just drop into feeling super relaxed. And then we ask clients, like, are you ready for your dose, which is like the real medicine? And this is a nice opportunity to check in with clients also, if this is our first time with them, on how they're responding to the medicine. Because some people are like, I could do long division, like I barely feel anything. And some folks are thinking like, wow, this is a big experience. I don't really know if I need more right now or I want to go deeper right away. Um, Most are like, okay, yeah, I'm ready. So we give them the eye shades and the headphones and the bigger dose, and they go inside for 45, 50 minutes. And then we have 75 minutes after they come back to the room, which is really like the golden hour. This is this beautiful opportunity when people are really open-hearted and um, more available to share what came up, and the sort of the quotes around what integration is in regards to making meaning out of these glimmers of what came up. But I really think it's a process. Like so many things come up, and we really just get to acknowledge all of them. We're scribes, we write everything down. And then we meet the following day for integration to assess like how does this land for you and what should we work on? But that's our ideal 3 hour appointment, followed by integration the next day.
Is it just with the one integration, or do you have others? Is this kind of like the plan to keep coming back to that session
Everything
and keep
again,
working it?
well, it's highly individualized. There are clients that come in with major depression, really stuck in a process that even just the biomedical component of the ketamine can be helpful for. So for those, we recommend the series of 4 to 6, and it's a 3 hour cap weekly, followed by integration. For some people, they're engaging in a life transition or struggling with why do I keep drinking, or what does this mean to me, or why am I in this relationship that's not working for me? So some folks can have one that are actively engaged with us on a psychotherapeutic relationship. We have a ketamine session, and then that brings up a lot for us to work through in the coming weeks. Some people do once, some people do it once a month. And we have also added oxytocin to the lower dose for clients that have a really hard access to any type of compassion for self or others. And that is helpful in allowing for a big shift during the experience. And then again, it's curated for the person.
So is the oxytocin it's in the same IM, or is it?
It's intranasal.
Okay.
Yeah, we work with a compounding pharmacy, and we draw it up in a little syringe and take the needle off and screw on a little spongy thing to the edge of the syringe so people can inhale 20 microunits.
So you are the founder of Home LA, and I'm excited to talk further about that. I know Home LA is a acronym that you'll share with us, but I really want to know too, what was that pivotal moment for you to actually go into founding Home LA?
Thank you for asking. It is an acronym. It stands for Healing Opportunities, Meaningful Evolution. And um, I've always enjoyed working in teams and collaboratively. And I think that collaboration is an important part of recovery because it just takes all different ways of healing, whether it's somatic experiencing, yoga, breath work, other type of embodied approaches, internal family systems, psychodynamic, DBT. There's just so much, and there's a limit to what I can do. And um, as an addiction psychiatrist, I tended to see clients from pharmacological perspective, you see clients once a month and you get a little bit of information. And so it's so nice to work collaboratively in teams. So I had the vision of getting it all under one roof. So I have an amazing team of clinicians that have subspecialties in everything that I did just mention, from somatic experiencing, traditional Chinese medicine, psychodynamic oriented therapy, DBT. And we work collaboratively in this really, it has evolved to be this nuanced thing where during staff meetings on Friday, we're talking about a client, and one of the clinicians will be like, oh, that client sounds like they need more of what more body work, or that client, well, maybe what about yoga? Like if we weren't even doing it. So
Yes.
we get to work together to have less blind spots and also be less agenda oriented, because I've also learned that through ketamine assisted psychotherapy that we like release our agenda towards um, the goal directed behavior we have working with people one on one.
Do
Yes.
you find that there is a certain demographic that is best suited for your practice?
Um, yeah, people that are interested in change. You can be anywhere in the process of it, but just want change. Yeah, wanting something different. Um, We tend to work with a reasonably higher functioning. Also, we're in Los Angeles, so a creative group. But because we have found ketamine-assisted psychotherapy to be so helpful for complex PTSD, we also have a specialty track called the Curated Trauma Recovery Program, where we integrate CAP into the container that we hold for clients that are working through trauma, not individual trauma as much. I mean, of course, yes, but what we see so much in practice in general is years of covert trauma that doesn't get really noticed as someone living with a trauma response. So that's also a subpopulation that we have seen a lot of. We feel fortunate to have been able to create a container for that transdiagnostic model of client.
Can you share with us a story, a specific story of a client who has come to you? They've come in one way, and then due to your process with therapeutic ketamine and everything that you offer there, they've had that transformation and the shift.
Sure. You know what? You asked for an example of something earlier, so I'm going to do both. Remember
Yes.
before you were like, what's an example of the dose distinction? So I had a client that was coming in for what we were referring to as the psychedelic dosing, like the bigger come in, have a dose where you're going to lie down with eye shades on and go inside for an hour. But during that session, he came in so agitated, like couldn't stop talking about this thing that was really up for him. He had a lot of energy in something that was distressing him. So it didn't seem right to just shut that down with an injection of ketamine. So for that session, we went with the psycholytic, and it allowed him to slow down and process all of what he was so amped up about in ways that regulated his nervous system, shifted the perspective that he experienced it in, and he was able to leave um, without the anger. And he really just released it. Like it was a shift for him. So that's a good example of that one. Um, yeah, I have another example of a client that, can I do one more dose dependent client shift?
Absolutely. Yes.
Um, I have another client that was coming in, complex PTSD. We were going to work on the higher dose. So I gave her the initial low dose and I handed her the eye mask, and their response was, how would I protect myself? And I was like, okay, this is not obviously you don't feel safe, so we're not going deeper at this time. And we just stayed and talked for the rest of the session. I didn't bring ketamine up again. They brought it up about 6 weeks later. And we went with such tiny little doses because for trauma, sometimes the nervous system is so dysregulated, there is not any familiar embodied sense of safety. So to offer somebody uh like 7 milligrams IM, it's like barely anything. But I was like, you're gonna feel it in 2 minutes, it's gonna peak at 9. So we talked through, like I sat next to her on the floor, and we talked through the minutes as they felt that they were coming on. And at 9 minutes, I shared, this is as strong as it's gonna feel because this is at its peak. Do you want to wear the eye shades and not talk for a couple of minutes and see how this feels for you? And she was like, okay. And then they were like, 30 seconds in, what should I be doing? Am I doing it right? And yes, but you're actually not supposed to be doing anything. Like you're just supposed to be relaxing. So we made an agreement that I would remind them every 30 seconds, you're doing a good job, just keep doing it. And they had that experience. And then after a couple of minutes, it was wearing off and they were coming back to the room and were able to share that that was the first time they had felt completely relaxed with no need to do anything in their memory for the past few decades.
Wow, I can just even, hear that in the way you're sharing the story, as well as just myself going, like
Yeah.
they just eased into it. That is beautiful. You talked about safety and the importance of safety, making sure that the nervous system really, really feels safe. What are the ways that you and those in your practice really prepare the client to feel that safe so that they can go deep in the medicine?
I've actually learned from a couple of my amazing team members um, the slowed down nuances of it all. One of my colleagues, Dr. Laramie, says he sits with people in the room and he says, like, how's the distance between us? And folks are like, it's fine. And then, but when you do something, they get to respond to it. You move closer and they're like, no. And then you move farther and they're like, actually, it's better with you further. And for some people, actually, like you sitting on the floor in front of them. You also have a conversation around what might come up and how this might feel uncomfortable for you. So asking clients like what's your response to surrender? We ask. And then we do some resourcing. Like, in EMDR, you do a lot of resourcing first before you actually get into the work of like revisiting the trauma. And what that really means is finding a safe space in the body. And sometimes that's through breath work. We work with clients to just breathe together. Like where are you breathing from? Is it a belly breath? Is it short? How does your body feel? So a lot of it is the somatic conversation around like what do you really notice if we sit here quietly together?
Beautiful.
So So preparation isn't just like the 1 hour where we get to know each other and this is what the room looks like and cool, see you next week. It can be for some because some people have been, preparing for this for their whole lives but some not. And some think they have, but when you get into it, they're not as ready as they think they are to
Hmm.
really feel the vulnerability and feel it. Another interesting we see with people doing ketamine that have unprocessed grief, and I mean, like, who doesn't? Like, what human on earth these days doesn't have grief? Some people, when we can get to the established sense of safety and relaxation, just cry for the first couple sessions. It's just a release.
Yes. Which is so important as well. It's just getting it out so they clear
Hmm.
the slate.
Yeah.
Yeah. So we are going to take a break right now, but when we come back, I want to hear more about the group experiences that you put together, the small groups. So we'll talk about that when we come back. This podcast is sponsored by Conscious Ketamine Coaching Academy. Step into the future of mental wellness. I'm Bronwyn Davis, founder of Conscious Ketamine Coaching Academy. This isn't just a career, it's a calling to guide deep, meaningful change by integrating transformative coaching with therapeutic ketamine, a cutting edge healing tool. We empower our clients to heal and grow beyond their expectations. Ready to make an impact? Click below to learn more. Welcome back to the Ketamine Coaching Academy. I'm Bronwyn Davis, your host, and I'm here with Dr. Eva, and we are having such a great conversation here. And I really want to go deep now into how you are using therapeutic ketamine with groups. I know you're working with small groups, so I want to hear more about what you are seeing and the benefits.
We offer small group ketamine experiences. Originally, I started these as trainings for clinicians or individuals in the healing arts, and they have evolved. Um, what we've noticed, I mean, I guess what I know from my own experience and heart is I think there's like a Bell Hooks quote that um, We are not healed in isolation. Healing is an act of community. And we're also not wounded in isolation. So healing comes in the orientation of community, in the support, in also in the act of witnessing and witnessing others. There's such a richer experience to have this sense of connection in the process of an altered state, feeling all of these vulnerable parts of yourselves that like are afraid to be looked at and don't want to be looked at. And sometimes these amazing mystical things that happen where like people that you've lost come back to visit you, or your core purpose in life presents itself, like it's not all painful. Some of it's like beautiful and amazing and awesome. And so to have these experiences in a group setting, the group itself can be the medicine and can amplify the experience. So what we found is we love doing these with for personal and spiritual growth, as well as for folks in the healing arts. And that's actually why we started the curated trauma recovery program at home, because we'd like to be able to offer these more as treatment and feel like it's really important to have a container for people, because this could open up a lot of things. And then you don't want to have opened things up for people and have them sort of left with all of their wounds on the surface and alone. And the groups are amazing. They have really been a way for participants to create a sense of community. But we also love the idea of retreats, which are not done here. That's like an opportunity for us to all gather for 2 or 3 days and have 2 experiences, as well as breath work, body work, and supportive care before and after.
Can you share with us a little bit more about how your retreats run?
You know what? We haven't done many client-based retreats. They've largely been for clinicians interested in the experience and or interested in personal and spiritual growth. I've done retreats in Jamaica with psilocybin, and my work with plant medicine is really what informed how we create these circles, like how we organize the container to not only have it be an opportunity for us to administer medicine, but for this to be a spiritual experience, to bring soul, spirit, body, movement. Like there's so many aspects of healing and connection that make themselves more available with an altered state of consciousness, which is why the retreats are a beautiful opportunity for us to have like a bigger, deeper opportunity to heal. We have one planned for spring of 2026, which is not just for clinicians. It's open for personal and spiritual growth. But we have calls with individuals before, because we certainly want to make sure everybody's psychiatrically and medically cleared beforehand. And there are some folks that might really want to do this, but just might not be appropriate for group work yet, because it could be a big opening.
Absolutely. So all of the participants, they come together.
Let's say we gather on Friday night, everybody, we have some drop-in breath work, we connect, and a nice dinner. The next morning, yoga or qigong, some type of embodied work. So you can have a little bit of breakfast, because you want to not eat or drink for a couple hours before. So that's why we try not to do the daytime ketamine journey until noon. So you can wake up, have a little breakfast, do the body movement, and then we gather. We have our large group experience where everybody's in the same room. And we have an increase in staff because we have an increase in participants. And what I've learned from my underground work and my psychedelic work is that as the group integration is really the most beautiful, rich part of the experience. So we have our first layer of integration that is still while you're in that slightly altered state in the room. Specifically with ketamine, you can get a little bit nauseous afterwards. So it's nice to be pre-medicate with Zofran. And it's also important to share with people like, don't get up before you're ready. Keep your eyes closed for as long as you want. So we still can, if we're back to the room, participate in listening and or even talking from a supine eyes closed position. Like you don't have to be sitting up and engaged in a circle to be like, oh my goodness, I cannot tell you what that was for me, and or cry and get support, and or support somebody, or say, I think you were in my journey. I saw you. Some really magical, mystical, wonderful things can happen in these. And then later we have a big meal that we share together, and in the evening, breath work. And the next day, we kind of do the whole thing again. And then Sunday, we have a large morning integration, which we kind of, it's easy. Like we have a breakfast, and then you bring some of your food. And because we want to have enough time to really not feel rushed and everybody to have as much time as they need, but we also orient ourselves that we are in counsel together. So be somewhat lean of speech because you want to know, you want everybody to listen to you. So don't talk more than necessary to keep room for everybody and to keep everybody together. So we do create the council style ground rules, which I also learned from working with other psychedelic medicines. And historically, people have been using this for hundreds of thousands of years. Indigenous tribes the world over have been using groups for healing, for rites of passage, for rituals. And it's something that we have lost in our sense of community as we're so disconnected now, really, as a humanity. So I do find a lot of excitement in moving forward in creating these group retreats.
And what do you notice by the end? I mean, here are these complete strangers. They come together. By the end, what are you seeing?
Um, we do a couple of virtual prep sessions. So we're not complete strangers by the time, but we've never met in person by the time we land together. Um, what It's transformational. Like people are open, people are like, they can feel their hearts. They're less afraid to say like, I love you and hug and connect. And love is just like an easy thing because you're in a space of compassion and forgiveness and kindness and acceptance, and also releasing some of our ties to these orientations of identity that we've been labeled or sort of layered with. And just, it's so beautiful.
Uh,
And a lot of people stay connected afterwards, like they make friends.
yes, absolutely. Because really, they're the only ones who were there to experience it. Like when they go home, they're talking to people who weren't there
Yes.
and can't really relate.
Yeah, it is a hard thing to explain how impactful this is to somebody that hasn't had the experience.
Yes. Well, thank you for sharing that because I love the idea and the concept of the group setting as well. And I want to shift gears a little bit and go back to what you were talking about earlier about addiction
Mm.
and how therapeutic ketamine is really beneficial. Can you share with us why and what you're seeing in your practice?
And I can also answer yes, and why I think of why I use the word harm reduction, because there are a lot of addiction psychiatrists and or psychiatrists that would say like, no, you can't use ketamine for somebody that's abusing any type of drug or alcohol. And that's like a specific orientation. But I think that is really throwing the baby away with the bathwater. I mean, just because you're in pain doesn't mean we should withhold care from you if this could possibly help. So what I've seen is not only does it really allow people to get to the root of what's causing them to engage in a repetitive pattern of behavior that is causing negative consequences in their life. It can allow them to release some of the shame around. There's a lot of secrecy around addiction. Like you feel ashamed and you don't want to share it, you don't want to talk about it, and you're hiding. And then if you have to go back to the meetings, you have to say you're sober again, even though it's been 28 years and you slit. Like there's so much that we there is so much rigidity around sobriety, particularly in Los Angeles. So to be open and flexible to allow people to find their own way. And the neurobiology of the medication is nice in terms of the neuroplasticity and synaptogenesis. It creates a state where we can create new ways of thinking, increasing cognitive and emotional flexibility. And so we can harness this window of change with clients. I mean, sometimes placebo or not, but this one actually isn't, by saying like, this is an opportunity for you to do what work, like engage in behaviors that nourish you and don't do things that you know aren't nourishing you. Go to yoga, don't drink, like all the specifics.
Yes, I love that. And I too, I agree 100%. Addiction is trauma. So we need more love and more
Yes.
acceptance and more just more
Yeah.
non-judgmental states and being in with people. So what I'm
Hmm.
hearing is you're really offering that.
Yes, not only as the physician in the room, but also modeling that so that they could do that for themselves. Like in creating that as like a this is a kinder way to be. Like you slip, like relapse is part of recovery. It's not like this is the whole picture of being human.
Yes, absolutely. I heard you say earlier that ketamine-assisted psychotherapy is not a revolution, it is an evolution. And I want to hear more from you on that.
Yes, gladly. So I think it's really if we are thoughtful, ethical delivering of this tool, which it is, we we harness everything we know, everything we've learned from like the the clinicians that came before us. How do I pronounce his name? Prochaska, who came up with the stages of change, you know, pre-contemplation, contemplation, ready for change. I don't even think that's limited to addiction. Like that's for all of folks in a process. Um, if I reflect on Yalom, who's an amazing group psychologist, he interviewed a whole bunch of clinicians, and what he came out with was the single most important component of a good psychologist is presence, just being present. And this is also because ketamine, like other psychedelics, is a non-specific amplifier. If we are mindful of the transference and the countertransference and all of the things that can normally happen in a psychotherapeutic relationship, we can be mindful that we all of this is amplified to the better and to the worse. So we have to be really clear on what we're doing and be really good therapists and really good psychiatrists. And in mentorship and in collaboration and not working alone. And that has really been the model of psychotherapy and psychiatry, I think, as it has been an evolving field. So really not separating ketamine assisted psychotherapy from the practice of good psychotherapy.
Mm, yes, yes, that's brilliant. What do you see for the future of therapeutic ketamine? If you were to look out 3 years, 3 to 5 years, where are you seeing the ketamine treatment industry heading?
I'm not sure it's heading where I want it to head, to be honest, because as a practitioner, I only ever prescribe in office because I think it is a highly abusable medication, and I don't think it should be used without a therapist involved. Um, I have a lot of concerns about the delivery of ketamine. There's organizations that will mail you, you know, 100 lozenges to your house that'll mail you injectable. It's really dangerous. and whether you're diverting, selling, overusing, underusing. I don't actually know where it's going, but I have a concern that's also a bigger concern for us, as I can't help but like wax a little philosophical on that one then, like a concern for us as a humanity. What are we doing? Like, what is geopolitically, climate-wise, medical system, having third-party payers? It's heartbreaking that it's so expensive. It would be nice if it was more affordable. The way I offer it is not highly affordable, and I think it's a really solid ethical delivery. And I know it's very challenging to make this model affordable, which is one of the reasons I think groups is an important model for the future. So maybe I circled back to answering your question, which is engaging in group work with individual prep and individual integration as well.
Hmm.
It'll be more cost effective because there's a limitation based on finances.
You have been such an amazing guest. I'm so thrilled with this conversation. How can people get a hold of you? Share with us more about Home LA. Where's your website? How can they reach you?
Thank you for asking, and thank you for the opportunity to talk with you and get to know you. So we are in Santa Monica, California. Home-la.com is our website. We are a multidisciplinary team of clinicians offering psychiatry, holistic and integrative psychiatry, from like herbalism to genetic testing to regular Western psychopharmacology, as well as traditional Chinese medicine, psychotherapy, breath work, body work, curated trauma recovery program. We all work in person. We do offer some virtual therapy options and psychiatry options. And if you'd like to email us or text, you can shoot us a text at 424-877-1333 or email info@home-la.com.
Dr. Eva, thank you so much. This has really been a very insightful conversation, and I just so appreciate the wisdom that you have brought to the table here and our conversation. So thank you so much.
Thank you. And it feels like there's never enough time because there's always so much we could talk about. I really appreciate you creating an opportunity for this.
Thank you.